I am Dr. Sharjeel and you are watching my YouTube channel. If you like my videos, you can subscribe to my channel and you will be updated about the future videos. Now today I am showing you this case. Here I am showing you the pupil reaction of this patient when bright light is shown. The pupil constricts, but then after a few seconds it redilates. So this patient is a case of pupillary hippus, which is also known as pupillary athetosis, in which there are spasmodic, rhythmic, regular dilating and contracting pupillary movements between the sphincter and dilator muscles. The pupil constricts to the direct light stimulus but cannot maintain constriction and slowly starts to dilate due to abnormal activity of autonomic nervous system, because there is imbalance of sympathetic dilator pupillary activity and parasympathetic sphincter activity that leads to hippus. Now hippus word is derived from the Greek hippos, meaning horse, as pupillary hippus looks just like rhythms of contraction of a galloping horse. So now you know from where it has got his name. Now it is a physiological or benign phenomena most of the times, but you should be aware of pathological hippus, because there is a term which is called pathological hippus, and the causes of pathological hippus are aconite poisoning, trauma, altered mental state, cirrhosis, liver disease and renal disease. In all those diseases, the cause is a frontal lobe dysfunction. Now why it is necessary to know physiological hippus well? Because it is a differential of pupil reaction, so you should be able to know that whether it is a normal physiological phenomena or the pathological conditions associated with pupil reactions like Marcus gun pupil or relative afferent pupillary defect or homus additonic pupil. So you should be able to know whether it is a physiological hippus or these things. Like if we differentiate it from RAPD or Marcus gun pupil, it is a relative afferent pupillary defect. You perform swinging flashlight test in which abnormal or pathological pupil dilates to the light stimulus instead of constriction. When you put the light on the normal pupil, both pupil constricts, and when you after 2 to 3 seconds comes around to the pathological, both pupils dilate. So when you put a torch on the diseased eye, the pupil will dilate to the light stimulus instead of constriction. So that will give you a clue that it is a case of Marcus gun pupil, and it is not a homus eddy pupil or pupillary hippus, because in hippus when you put a bright light, the pupil will first constrict and then it will start to dilate. It will not maintain its constriction. Now the another differential is Eddy's tonic pupil, and how to differentiate it from hippus, because in homus Eddy's pupil there will be anisocoria. The defective pupil or the defective eye pupil will be larger than the normal one, and the affected pupil constricts slowly when exposed to bright light, as well as dilates or redilates slowly when exposed to dark, and the movements are vermiform like movements. So that's how you differentiate Eddy's relative afferent pupillary defect or Marcus gun pupil from a normal physiological pupillary hippus. In this video I have shown you a patient who was totally normal, but on pupillary examination I diagnosed him as a case of pupillary hippus. Now most of the candidates giving eye exams, when they are exposed to a case of pupillary hippus, they become confused and they usually think that it is some pathological phenomena, and they misdiagnose pupillary hippus as Marcus gun pupil. So here I have given in detail how to differentiate these three entities and how hippus looks like. Thank you very much.